Genetics is the study of DNA and chromosomes. So oftentimes it's looking at things that can be passed down through families, like our hair color and our eye color, but could also be a genetic condition that could have serious medical implications. After an individual gets a diagnosis, we do see patients back in clinic for follow-up, but oftentimes the ongoing day-to-day treatment of the condition occurs in other clinics. When you come in for your genetics appointment, oftentimes we've asked you to do a few things before. You're going to get mailed paperwork, and that paperwork is going to ask questions about why you were referred to clinic, the main concerns you have for your child, and also answer some questions about relatives. If a family can fill that out, it can give them a head start on gathering that information and being prepared for the questions that we'll ask during the visit. Our appointments are pretty long. It includes a lot of information like medical history, family history, social history, and also getting a full clinical exam. So prepare for a longer visit, whether that's bringing electronics or bringing snacks, or if it's bringing siblings, knowing that there is a sibling playroom that can be utilized for care of other children. Before your visit, if you have specific questions that you want to make sure get covered, make a list, write them down, so the day of the visit you can make sure that that information gets communicated to the care team. One of the major misconceptions that families often have before coming to their clinical genetics visit is that we'll be able to diagnose their child with a genetic condition that day. Not every patient that's evaluated in the genetics clinic needs genetic testing, and that can be for a variety of different reasons. There are some genetic conditions that we can give a clinical diagnosis to, which means after evaluation we can feel very confident that this is the genetic condition that we're dealing with. But if we do pursue genetic testing, which is actually blood work to confirm a genetic condition, we have to ask the insurance company for permission to do that test before we can pursue it. Genetic testing is very expensive, so we work really, really hard to make sure we get the insurance piece completely covered before we pursue any type of test. The insurance company does have up to 30 days to respond to our request, so it can take weeks before we hear back from the insurance company and we get permission to do the test. Getting the results from a genetic test can take oftentimes multiple months. It is an extensive process, but we work really hard to keep the families updated on where we are in that process, and we always invite families to call in and check in so they can better understand where we are in the process. We understand how to do genetic testing. We don't always understand how to interpret the results of a genetic test. So it's really important for families to be aware that results might come back in a gray zone. So sometimes it's just telling the family that we need to wait a little bit longer and we'll follow up in a year or two and reassess the situation after some time has passed. We might be the specialist in genetic conditions, but you're going to be the specialist in your child. So we really encourage families to participate in the appointments and stick with us through the whole process. Again, the more involved that a family is, the more likely we are to successfully complete all of the recommendations that we've made at the appointment. On behalf of the entire genetics team, we look forward to working with you.